Hello, everybody. My name is Barbara Verboven. I'm a pharmacist and I'm the project manager of the project of suicide prevention in Belgium pharmacies. This project is currently being developed in Flanders, a part of Belgium, by VAN. VAN is the representative Flemish network organization of the professional associations for pharmacists in Flanders. VAN acts as a point of contact and the voice of the pharmacist to the Flemish government and all organizations involved in health and welfare. In this way, VAN supports the pharmacist in his daily practice, promotes the development of pharmaceutical care, prevention and health projects with a view to the valorization of the profession. Worldwide, more than 700,000 people die by suicide each year. The World Health Organization goal is to reduce this number by 1/3 by 2030. In Flanders, almost 1,000 people die by suicide each year. More than 15% dies from poisoning. In case of suicide attempts, we see almost 70% happen with medication. Scientific evidence shows that if you limit access to drugs, the number of suicide attempts and suicides decrease. It is therefore a very effective prevention method. It is logic that pharmacists play a crucial role in this because they are the distributors of the medication, but also the confidant of a lot of patients. In addition, pharmacies are very accessible, very approachable. They're very close to their patients and they know their patients very well. The Ipsos Trust Index also showed that the pharmacist is the most trusted, which is very important in this. It's a very important factor in this topic because it still is a little bit of a taboo. For many years, pharmacists have been preparing medication schemes in Belgium and support and guide their patients in their medication use. So since 2017, the concept of huisapotheker, or in English, the family pharmacist, exists in Belgium. This is an official recognition of the pharmacist's work for chronic patients who meet certain criteria, such as at least 5 reimbursed chronic drugs. The objective is to expand this role as pharmacist. For example, pharmacists have also been conducting mental health discussions with their patients for many years. The need of such conversations has clearly increased in the recent years. And that is why VAN has chosen very specific to further develop this team within pharmacies and to enlarge the task of the family pharmacist in this topic. VLESP, the Vlaams Expertisecentrum Suïcidepreventie Prevention, and VAN, so the Vlaams Pharmacists Network, started a collaboration around this theme in the beginning of this year. This project is also funded by the Flemish government, and it's a project for 2 years. The aim of the project in Belgium, currently only in Flanders, is first of all to provide the pharmacist and the entire team with the necessary knowledge on this subject. Therefore, a specific training is developed in collaboration with the Knowledge Center for all the pharmacists who want to participate in the pilot project. The training will consist of an online webinar or e-learning, followed by a physical workshop with practice-based cases. Because we also see it is very important that the pharmacist and his team gain self-confidence around this topic and can practice effective conversation. After the training, it is important that people in the pharmacy are able to question patients on this topic and detect whether or not there is a problem. When identifying a problem, it is important that the pharmacist can start referring to the right person or the right institution. In addition, there are also certain extra actions possible in the pharmacy, such as an adapted delivery, with smaller boxes, or the preparation of a box with all the medication for 1 week. This is, of course, always in consultation with the patient, but also with other healthcare providers, just like the GP. The effective pilot project will start after the training. It's the intention to include about 50 pharmacies, and we want to involve at least 2 first-line zones. I'm gonna explain you a little bit more about that. And in Flanders, there are 60 zones, and we call them the first-line zones. And they are created in the summer of 2020. And these are geographically based, defined areas where local governments, healthcare providers, and patients work together on an accessible primary care system. Within these primary care zones, various groups of healthcare providers are grouping together. Similarly with VAN, we are working very hard to group local pharmacists into such a local network to work truly locally and engage all health professionals. For this project, VLESP started an intensive literature study to find out which initiatives around this theme are already being taken worldwide. I also had contact with the European Organization for Pharmacists, so called the PGU. And through FIP, I came into contact with a worldwide expert in this field. It's the British Dr. Hayley Gorton. Her research also demonstrated the importance of a well-developed training program. The second step in the project is now to launch a survey among the Flemish pharmacies. This way, we want to get a real good insight into the current knowledge, experiences, and needs of the pharmacists and their team. Furthermore, we also want to examine if the pharmacists themselves form a risk group for the moment. The aim of this project is to start as many conversations as possible about mental health, to break the taboo, and if there is really a risk of suicide, to react immediately and to refer and to start any action that are possible in the pharmacy. Therefore, at the beginning of the project, there will be a baseline measurement of the participating pharmacies. And at the end of the project, we will check whether the participating pharmacists have the necessary resources, training, support, and knowledge to really work qualitatively around this theme in the pharmacy. From this evaluation, we want to learn further lessons, recommendations, and insights before rolling out the project on a larger scale in Flanders and possibly in Belgium. In this project, we will, of course, also contact other healthcare providers in the area, so they are aware of the project and they can also give their input. Collaboration is always the key to success. It is therefore also my goal to make after this project an MFO. An MFO that is a specific concept in Belgium where doctors and pharmacists consult locally each other around a specific topic and make agreements with each other. So I hope with this video that I have informed you a little bit about this project in Belgium and the importance of the role of the pharmacist in this topic. If you have any questions, you can always contact me or my colleagues from VAN or VLESP. Thank you for watching.